Fall marks the start of RSV season, a time when many healthcare providers want parents to be aware of the risk of RSV for their children. What many people may not know is that RSV can impact anyone. I talked with Dr. Leonard Fredlin about the RSV vaccine and about a campaign bringing awareness of the virus. Good morning, doctor. How are you this morning?
Great, Brad. Nice to have you speaking with me. Appreciate it.
Yeah, well, this is a very important topic because what is Sideline RSV campaign right now?
Yeah, thanks for asking about that, Brad. Just introduce myself, Dr. Leonard Friedland, a vaccine research scientist at GSK and also a pediatrician in Philadelphia. Sideline RSV is a campaign to raise awareness about RSV in adults, and we've had the opportunity to team up with the basketball legend Magic Johnson to sort of bring this discussion about RSV, to use a basketball terminology. We want to bring it center court so that people are talking about it, thinking about it, taking action as well. And our ultimate goal is that we kind of like sideline RSV, put it on the side so we can get on living our healthy lives and not have to be concerned that this particular infection could cause problems in the adult population.
Okay, but what is RSV for those that don't know the abbreviation here?
Absolutely. So RSV is a virus, and it stands for respiratory syncytial virus. That's a lot of words, so everybody just calls it RSV. But it's a very common virus, Brad, and it's contagious. In fact, it's very contagious. It's spread from people coughing and sneezing, but you can also pick it up on contaminated surfaces like countertops and doorknobs. And when that happens, it gets on our fingers, we put it in our mouth and nose and eyes, and that's how it spreads. So respiratory spread, very, very common. Brad, it infects people of all ages, from the very, very young to the very, very old. In fact, we get RSV many times throughout our lives. We're constantly infected with this. Causes serious disease in the very young and in the adults, particularly those over the age of 60, especially adults over the age of 60 who have underlying heart and lung disease and also diabetes. So asthma, congestive heart failure, chronic obstructive pulmonary disease. That puts the adult over age 60, if they get an RSV infection, at increased risk of getting a very serious RSV infection. And just some numbers, Brad, of adults over the age of 65 in the U.S., 177,000 hospitalized every year. Wow. And of those, 14,000 die from RSV every year, adults over the age of 65. So that's what the disease is, and that's why we need to know about it, because thankfully, there's now something we can do about it as well.
Yeah. Okay, doctor, let's talk about symptoms, because you just said some very important stuff, is that it's kind of easy to catch, as you mentioned, people sneezing, coughing, using doorknobs and stuff. So what are some of the symptoms we need to look for and what we need to do?
Yeah, so it typically starts as what we just say is like a mild cold. So cough, runny nose, sneezing, that would be the upper airway. But RSV can also infect the lower airway, and so that's when you can start to have wheezing and also the development of pneumonia. And now, typically, the disease will last for 1 or 2 weeks, but for some people, it can get worse, and it can result in hospitalizations, then being in the ICU. And as mentioned, 14,000 adults every year dying from RSV. And so the other thing, Brad, is that initially, the symptoms, to start with, that cough, runny nose, sneezing, it really overlaps with the other respiratory viruses, influenza and COVID, as perfect examples. In fact, in the last couple of years, if you had an upper respiratory infection or maybe even a lower respiratory infection, and you were tested for influenza and for COVID, and they both came back negative, RSV could have been one of the viruses that was causing your symptoms. And the other thing, Brad, is that there's no treatment for RSV for adults. So for flu and COVID, we now have oral medicines you can take that can help you get better faster. Nothing exists for RSV. There are no medications to treat RSV for adults. And the good news is now for the first time, this is the first RSV season. By the way, RSV tends to be circulating in the fall, winter, and early spring. So we're in RSV season right now. We can assume that for sure. For the first time, the first RSV season ever, we now have vaccination options available for adults over the age of 60. The Centers for Disease Control is recommending that all adults over the age of 60 can receive a single dose of RSV vaccine after having a discussion with their healthcare provider, their doctor, their nurse, their pharmacist about RSV, the vaccination options, and then making a decision that's best for them.
Wow, doctor, this is such news I don't know about, and I'm little older, so it's something I definitely want to check into to see more about. Where can we find out more information on this?
Yeah, so we have this campaign, sidelinersv.com, sidelinersv.com, where we've teamed up with Magic Johnson. Mr. Johnson and I, he's such an amazing individual, just completely focused in on health and wellness and bringing information to everybody in the United States, all communities to take action based on knowledge. We've shot a number of different that's like a basketball term, I guess. We've shot a couple of videos together where we talk about what is RSV, why you should know about this, what you can do about it. They're sort of fun videos. I got to play basketball with him. I let him win. And there you can get this information. And then the key is to then go have the discussion. Go speak to your doctor, your pharmacist, your nurse. Tell your friends and family. For those who have parents, grandparents, let them know about it as well. Take ownership and action so we can keep ourselves as healthy as possible and live our absolute best lives. And I'm really proud that we're teaming up with Mr. Johnson because this campaign, I think, is really important.
Yeah.
And he is a very, he's a resource that people trust for knowledge and information. And his whole life is about health and wellness. And it's been a real honor to work with him and create this campaign, and also myself to be involved in this field and knowing that we have now options that can help protect against RSV. So take that information, sidelinersv.com is where I would get started.
Perfect. Doctor, that's awesome. I know Magic Johnson personally. He's a great guy and awesome, and I'm glad you let him win. He needs some of that at times with the basketball. So, Doctor, thanks for joining us this morning.
Take care. Thank you very much. sidelinersv.com.